welcome you to our module Parkinson's and Huntington's disease, HCC 78 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of Parkinson's and Huntington's disease. At the end of this module, the learner will be able to distinguish between Parkinson's and Huntington's disease, identify the ICD-10 codes that fall under Parkinson's and Huntington's disease, discuss the criteria for the documentation of Parkinson's and Huntington's disease, review the example of the assessment and plan for Parkinson's and Huntington's disease. Parkinson's disease is a progressive nervous system disorder that affects movement. It is reported that complications due to Parkinson's are the 14th major cause of death in the United States, and more than 50,000 new cases are reported every year. Smooth and coordinated muscle movement of the body is caused by dopamine, which is created in the substantia nigra part of the brain. In Parkinson's, the cells present in substantia nigra start to die, thus reducing the dopamine levels. When they have dropped 60 to 80%, symptoms of Parkinson's start to appear. Initially, the symptoms are barely noticeable, and the face may show little or no expression at all, but gradually tremors, stiffness, and slow movement occur. The symptoms worsen as the condition progresses over time. The speech may become soft or slurred, and the arms may swing while walking. Although the disease is incurable, treatment and medication can significantly improve the patient's condition. Huntington's disease, on the other hand, is also a progressive nervous system disorder that is hereditary in nature. It is also called HD. Huntington's disease affects around 30,000 people in the United States. And the first signs normally occur between the age of 30 and 50, but the disease may manifest later in life. It is an autosomal dominant disorder caused by an inherited defect in a single gene. Huntington's disease usually causes movement, cognitive and psychiatric disorders with varying signs and symptoms. It can cause involuntary jerking, abnormal eye movements, lack of awareness of one's own behaviors and abilities, insomnia, or even suicidal impulses. Huntington's disease and Parkinson's disease are pretty similar in nature, as both are caused due to death of brain cells and are neurodegenerative disorders, but Huntington's disease manifests between the age of 30 to 50 and Parkinson's disease is first diagnosed in people who are over 50. The criteria for the final diagnosis of both Huntington's and Parkinson's disease require consultation with a specialist, treatment with anti-Parkinsonian medications in case of Parkinson's, and a positive genetic study in case of Huntington's. The family history is also considered in case of HD. And lastly, a positive neurological physical examination for both diseases is conducted for the diagnosis. Now, let's look at the different ICD-10 codes considered for Parkinson's and Huntington's disease along with their HCC category. The code for Huntington's disease is G10. And the HCC category is 78. For Parkinson's disease, the ICD-10 code is G20. The HCC being 78. For other drug-induced secondary Parkinsonism, the code is G21.19. And the HCC is 78. For secondary Parkinsonism due to external agents, the code is G21.2. And the HCC is 78. Post-encephalitic Parkinsonism is coded as G21.3. The HCC being 78. The code for vascular Parkinsonism is G21.4. And the HCC is 78. For other secondary Parkinsonism, the code is G21.8. And the HCC is 78. Lastly, for unspecified secondary Parkinson's, the ICD-10 is G21.9. And the HCC category is 78. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of a progress note for Parkinson's disease. Patient name: Ray Charles. Date of service: July 21, 2019. Date of birth: September 23, 1939. Assessment and plan. Monitor. Stable with no new complaints. Continue carbidopa/levodopa 25 mg POT'd. Follow with neurologist next week. Follow in this office in 3 months. We have reached the end of our short refresher course on Parkinson's and Huntington's disease. We gave you a short introduction to Parkinson's and Huntington's diseases, distinguished between these diseases, identified the specific codes and HCC categories pertaining to them, and finally reviewed the assessment and plan for the diagnosis of Huntington's and Parkinson's diseases. Thank you for joining us.